This Good to Go segment is sponsored by Spectrum Health Medical Group.
Sickle cell disease, also known as sickle cell anemia, is a common inherited blood disorder. And according to the CDC, it affects between 70 and 100,000 people in this country. But what is it really? Well, Dr. Matthew Pridgeon is a pediatric hematologist and director of the sickle cell program at Helen DeVos Children's Hospital. And he joins us now to talk more about it. Hi, Dr. Pridgeon.
Hi, how are you?
I am well, thank you. What is sickle cell disease or sickle cell anemia?
Yeah, well, like you said, it is an inherited blood disorder. And really what it is, it's an abnormality of the red blood cells. And specifically, the molecule within that is called hemoglobin, and that's what carries oxygen to everywhere in the body. And that hemoglobin is malformed such that those red blood cells became misshapen. Instead of being nice, round, soft discs, they're in that classic sickle form, or kind of, as my younger patients say, kind of like a crescent moon or a banana. And that leads to the problem such that oxygen is not delivered appropriately, and those red blood cells don't live as long, and also they can plug up blood vessels.
And what does all of that mean to the human body then?
Yeah, exactly. It can affect everywhere in the human body. So if we are blocking up blood vessels and not carrying that oxygen appropriately, every single organ can be impacted. So classically, people think about pain with sickle cell, and that's when it's not getting to the muscles and the bones, but it also can infect all of our other major organs, the lungs, the heart, the spleen, the kidneys. And so we're watching for problems or complications with the entire body.
I didn't know it could be diagnosed at birth. Is that traditionally how it's done?
Yeah, so the majority of our patients now are diagnosed at birth. Here in the state of Michigan, we have the newborn screen, which we started screening for that back in the 80s. And many other states in the US have that as well. So we know normally by the time these children are 3 to 4 weeks of age.
How does Spectrum Health treat children who are diagnosed with sickle cell?
Yeah, so we have a comprehensive medical team that really is trying to focus on the entire patient and meet all of their both psychosocial and medical needs. Specifically, we also are going to focus on what is that patient's individual challenges. So we're starting with education on the complications. We treat complications as they come up. The things that most commonly occur is pain. So we're treating pain with various, hey, how do you approach life and lifestyle modifications and pain medications. Other medications for our patients that are more severely impacted. The classic is hydrea, which has been shown to be very beneficial to minimize complications in sickle cell and help improve their overall just health. And then there's newer agents that are hitting the market. Bone marrow transplant is something that is used in select cases in severely impacted patients. And then finally, blood transfusions are also a supportive measure that are used for many patients, both acutely, but also on a long-standing basis.
How can the community help to support these patients?
Yeah, so that's another great question. A lot of times when I get that question, I start with, hey, reach out to those around you, a friend, a neighbor, a coworker. Everybody has their own